The emotions runs very high when you are having a new person coming to the family. Breast milk is one of the best way of giving a good immune booster to the baby.
So every gram and every second counts.
Colostrum is considered to be a magic bullet and first vaccine to the baby. Baby smiles at you, you feel that your job is done.
So welcome to the program, Doctor, and it's a pleasure having you.
Hello, namaste Andy.
So neonatology, it's such a complex yet incredibly delicate field. So how do you handle such delicate lives, fragile lives?
Neonatal period is the most crucial period. It accounts for the first 28 days of life. In that, the first few hours to days are more important. And we need to deal with the baby surrounded by the complete emotions of family. As we know, the emotions runs very high when you are having a new person coming to the family. We as a neonatologists deal these tiny babies in the precious periods backed up by a good science and evidence. We have been trained for it and we are equipped with necessary equipments and the facilities to deal with any sort of stress situations. This will try to help the baby to transit in a smooth manner from a complete protected environment in the womb to new world.
So working continuously throughout the day and night in an NICU. So how would you like to explain what exactly is happening behind the doors of an NICU?
So Neonatal Intensive Care Unit, for that matter any intensive care unit, is always a challenging job for a clinician. We as a lead consultants and a clinical team member, we take holistic view of that baby from both the inputs from a clinical team and also from the monitors which are available, and we will analyze it completely whenever we are going and seeing those babies. It's not a single time monitoring. We will look at a continuous monitoring and then try to analyze these points which are there for that baby, and we will again sit with the both doctors and nurses and then see what best can be done for this baby. But we all feel happy when any tiny baby goes home with complete intact survival. The way when they come back and baby smiles at you, you feel that your job is done. And at the end of the day, when the baby is going home, you also look at the expressions of the family. They feel so relaxed, coming away from the tense moments when the baby was in NICU. That will give you a pleasure and joy.
So every gram and every second counts. So how do you take some quick and accurate decisions?
Yeah.
I'm sure that is not easy.
For us, each gram matters. And even few seconds, if we are not alert or we are not able to diagnose a condition, then we might make the baby to go into a critical situation. We deal it with utmost professional way. This is not a single person job. Always, intensive care unit management is a team job. It needs lot of dedication. We need to spend lot of time. Yes, it is challenging, but with the teamwork, we are able to manage it.
So bringing a newborn, into the family, I'm sure it's one of the happiest moments and also honestly one of the overwhelming moments in every parent's life. So how important is newborn care, especially at home during the first few days or weeks?
Yes, especially in this era of nuclear families and not getting exposed to siblings, deliveries and caring of the other kids, what we used to have in the combined families, that era is gone now. So now the challenge comes when the baby goes home and how a new parents can tackle it. Realistically, newborn care requires very simple approach. We just need to concentrate on some basics. Basics include providing good warmth to the baby, where the baby will not get exposed to any low temperatures and not goes into any stress period. Second is the nutrition. Breast milk is the breast. We need to empower the mother and the whole family to provide adequate support to the mother to have a successful breastfeeding. Thereby, the baby can grow better and will not go into any excessive weight loss or a hypoglycemic episodes, that's a low sugar episodes. Third one is the aseptic precautions, where we need to take care of good hand hygiene and other hygienic aspects in the environment so that the baby will not get into any infection.
So another common and important aspect is feeding. Though it might sound very simple, but it's very complex. I'm sure most of the parents, especially mothers, keep asking, is my breast milk enough? Should I go for the bottle feed? So what are some concerns regarding this?
So this is one of the common questions that the mothers will ask us. Is my milk enough? See, it's a nature's beauty and nature's decision that we are provided with the breast milk. And nature has the capacity to improve the mother's own milk and give sufficient milk for the baby in terms of both the quantity and quality. We as a clinical team members have to provide enough knowledge to these mothers and also the couple and families so that they will not go into any trap of guilt or go into formula feeding. So how we know that mother is feeding better? So one is that if the baby is latching better and feeding continuously for 10 to 15 minutes in the beginning period and taking a nap at least for 1 to 1.5 hours after a good feeding and passing 4 to 5 times urine, that means that that baby is getting enough milk. Mother complains to me that when I am pressing, I am not getting high amount of milk or not a good flow. Yes, that can happen. But when the baby sucks, many of the hormones will get activated and provide a good continuous flow and increase the amount whatever is required for the baby. Especially in the first 3 days of life, many of the mothers will complain that I am having very limited output or even after pressing I am not getting it. In the first 72 hours of life, mother will be producing colostrum. It is different milk compared to any mature milk. Colostrum is very dense milk where both the quality of sugars, fats and protein is different. That even if baby takes in a small amount, baby's needs will be met. So this has to be important to the parents with good counseling.
Another aspect is sleep. Newborn babies are known to sleep, for about 18 to 19 hours or 20 hours. But yet parents complain of sleepless nights. Why do you think that's happening?
So the newborn sleep pattern is completely different to an adult. So in the initial 2 weeks, usually many of the kids will get up once in 2 to 4 hours. Even after 4 hours, if the baby is not getting up, you can just stimulate and see whether the baby is active or showing some movements. If baby is showing some movements, you should not be worried. If the baby is continuously sleepy, even after stimulation, the baby is not getting up, then you should feel that that baby is having some problem. Other extreme is that some parents keep complaining that baby cries a lot in the night. In the initial first 2 weeks, the sleep pattern has to change from what was there in the womb. In the womb, when the mother is sleeping, the baby will have more activity because the baby will be swimming in the amniotic fluid as the mother is placed stationary. So with this, the pattern of the baby in the first few days in the new world will be similar. So the baby will be very active. And at the same time, when the baby is kicking on inside the uterus, the baby will have a positive feedback from uterine muscles. So baby will feel comfortable. So when the baby comes out, when the baby is like this, baby will feel discomfort. Then you have to keep cuddled for these babies so that they feel secure and sleep better. Parents also will tell that when I'm taking the baby to my lap or when I'm taking it onto my chest, baby is completely comfortable. Yes, the baby needs that secure position and good cuddling. The baby will sleep properly. This we have to provide it.
I think this is an interesting aspect which most of us, I'm sure, we didn't know. So are there any precautions that, parents should closely follow, especially during the first few weeks when the baby is sleeping?
Yes, protected sleep environment is one of the important things that we need to do it. What is meant by protected sleep environment? So surrounding the baby, there should not be any soft clothing or soft bedding should be discouraged. Because if you have a soft cloth which is going and touching the nostrils of the baby or mouth of the baby, that can obstruct the baby's breathing pattern, which can lead to critical respiratory problems and sometimes a life-threatening event also. So that is the reason why we need to keep the baby's position and bedding in a proper manner. It is better to make the baby sleep in the supine position rather than the prone when you are not supervising the baby. It has shown to reduce the acute life-threatening events.
Another important aspect is bathing. Most of the parents ask, how important is bathing? How often should we give bath to newborn? So how would you like to address this?
So bathing used to be a norm after the baby is born immediately. So now it has shown that delayed bathing improves the baby's stability. So initially, we delay the bathing for at least 24 hours of life. After 24 hours also, we just do the sponge bathing for the baby. So thereby, baby is not getting exposed to very cold environment. Especially the full bathing can be delayed till the umbilical cord is completely healed. If the umbilical cord is getting wet frequently, it won't heal. More oftenly, it might get infected also. So that can cause more life-threatening problems to the baby.
Another common question is, doctor, immunity. I'm sure newborn babies are low in immunity. So how do you protect or improve the immunity over a period of time?
So the immunity is the major aspect in the neonates. Immunity matures over a period of time. In the vulnerable period, we should not expose the baby to infections. How can we do it? One is keeping the environment hygienic. Before touching the baby, maintaining a good hand hygiene, avoiding the people with infections touching the baby and coming into the vicinity of the baby's care. Giving the babies the birth vaccines will go a long way in improving their immunity. Breast milk is one of the best way of giving a good immune booster to the baby, especially what I told is the colostrum. Colostrum is considered to be a magic bullet and first vaccine to the baby.
Are there any warning signs, parents should be aware of and they should quickly recognize that and take the newborn to the hospital? Are there any such signs, doctor?
Parents should be aware of these things, especially in the newborn period. So we say one is fever, that means that body temperature more than 100 degrees Fahrenheit. If the baby is feeling like that, better to consult a doctor. Second is a persistent vomiting, that to a large amount of vomiting. Third is that if the baby is looking too much yellow or showing any signs of abnormal movements, or sometimes the baby might be quite lethargic, then also you should go to the doctor. Some rare episodes like a bluish discoloration of the baby or baby is too cold to touch and not getting stimulated while you are touching the baby or providing some stimulus.
So if there is one reassuring message that you would like to share with the parents out there, especially the first-time parents, what is that, doctor?
Being a new parent, it might be challenging for you, especially in the era of so much of information, you might be getting confused. Having the information is good, definitely, but take the information from a good resources. If you have a doubt, meet your pediatricians for any consultation. Keep your parenthood simple, don't be too confusing. Follow the principles which I have told, that is providing warmth, providing good breastfeeding, maintaining aseptic precautions while caring the babies. With these simple principles, definitely your parenthood will be stress-free and joyous.
So I think, not every parent is perfect, but with the right knowledge, we can be confident and we can deal with any issues if faced at all. So thank you, doctor, for such an empowering podcast, and thank you for clearing most of the doubts, especially for the new parents, I can say.
In India, we have the healthcare facilities for our children at every nook and corner. Take the help of a good pediatricians who are there nearby to clear your doubts and have a successful parenthood. Thank you.